Greetings of the day, folks. Today we are going to discuss about strabismus. Strabismus is ocular misalignment. So, the knowledge of pre-existing strabismus helps differentiate between congenital or childhood strabismus and acquired emergent causes of strabismus. The misalignment can be described as tropia or constant misalignment or aphoria. Okay, or a intermittent misalignment, such as when the patient is tired or fusion is broken. That is called phoria, that is intermittent misalignment. With phoria, eyes will revert to normal alignment when both eyes are uncovered. Okay, the terminology used to describe strabismus is listed in this table. So let's go through that. So esotropia is inward eye deviation, exotropia is outward eye deviation, hypertropia is upward, and hypotrophia is downward. Now these are the tropias, which is a constant misalignment. Okay, remember the term constant misalignment. Now coming to phoria, that is esophoria and exophoria. Esophoria is inward eye deviation when other eye is covered. Exo is outward eye deviation when the other eye is covered. Okay. So the normal newborns may have transient misalignment that usually improves by 3 to 4 months of age as the strength of extraocular muscles improves. Amblyopia is a loss of visual acuity not correctable by glasses in an otherwise healthy eye. Okay, so it's a loss of visual acuity that is not even correctable by glasses. Okay, uh, uncorrected strabismus can cause amblyopia. Okay, if children have unilateral visual impairment, their brain will choose the image presented by the eye with better vision. If amblyopia is not corrected by the age of 10 years old, the brain will eventually suppress the visual information presented by the impaired eye, leading to permanent vision loss. So we must be careful that the patient does not go into this. So we'll look at the causes of strabismus. So the emergent causes of strabismus include cranial nerve palsy during delivery. There might be some fractures or any injury, iatrogenic injuries. Because of that, there might be some cranial nerve injuries, or there might be some hematoma formation because of injuries. And also in muscle restriction or entrapment that may be associated with trauma, stroke, tumor, aneurysm, thyroid associated cardiopathy, or other infiltrative processes. Increased intracranial pressure or infection may also cause strabismus. Okay, so the innervation of the extraocular muscles defines which cranial nerve is involved. The cranial nerve 6 innervates the ipsilateral lateral rectus muscle, and palsy will lead to esotropia, that is, inward deviation. Cranial nerve 4 innervates the ipsilateral superior oblique muscle, and palsy will lead to hypertropia. Okay, so cranial nerve 3, that is oculomotor, involves all other extraocular muscles, and palsy will lead to exotropia, hypertropia, or hypotropia, depending on which branch is affected. Now, coming to the diagnosis and the management, is usually normally strabismus is usually suspected after general inspection. The some children have epicanthal folds that lead to pseudostrabismus or appearance of ocular misalignments even when the eyes are in proper alignment. Let's look have an image. This is where because of the epicanthal fold, it is looking like a strabismus, but it is not actually. The patient's ocular alignment is normal. Okay, so this is termed as pseudostrabismus. Okay, two simple tests can identify true strabismus. Begin with the Hirschberg test by holding a pen light several feet from the child and observe the reflection of the light on each cornea. In normal ocular alignment, that is pseudo in case of pseudostrabismus, which so the light reflection will appear on the same position of each eye. In true strabismus, light reflection will not be on the same position of the each eye. Then we have to perform the cover test. We must have a child fixate on a distant object and then cover one of the child's eye. If the uncovered eye then moves, it can be assumed that it was not properly fixated on the object and true strabismus is present. When the eyes are uncovered, they will revert to their original misalignment. Historical clues to an emergent causes of strabismus include trauma, diplopia, and a report of abnormal extraocular movements, sunsetting of eyes, up gaze deficit, nausea, vomiting, and lethargy. If an emergent causes of strabismus is suspected, then obtain imaging it directed at the suspected condition. Okay, so we must look at the historical clues. Okay, that is like trauma, diplopia, report of any abnormal extraocular movements, setting of eyes, nausea, vomiting, and lethargy. So in these cases, we must. I'm reiterating because this is very important. Okay. So, the congenital strabismus caused by extraocular muscle weakness usually self-resolves in infancy, and and in case of stable strabismus that persists into the childhood should be referred non-emergently to an ophthalmologist. Strabismus caused by amblyopia often resolves with glasses that equalize the vision, although a patch over the good eye or surgical correction may be required. Thank you, guys. Have a nice day.